All right, it's 3 o'clock. I want to welcome everyone to our sixth and final webinar in our series on health literacy and chronic disease. Just some housekeeping notes for folks who are joining us. Please go ahead and complete our pre-webinar survey at this link if you haven't already done so. After the webinar, you can request the slides at our request link here. As an attendee, you are automatically muted. If you have any questions, please type them in our Q&A box, and when Dr. Horowitz pauses for questions, I will relay those to her. And finally, if you're having trouble with audio, you can call into the webinar here at this phone number, 415-655-0002 with the access code 120-910-1675. And we are working with the Maryland Department of Health, the Horowitz Center for Health Literacy and this training is part of a set on health literacy and chronic disease created for the Maryland Department of Health. Our audience is healthcare professionals, public health professionals, anyone working at the county level on chronic disease and who has an interest in health literacy. If you want to access our other trainings and our recordings, you can go to the link on this slide. And without further ado, I'll turn it over to Dr. Alice Horowitz, who is our speaker for today.
Thank you very much, Anna, and welcome everyone to this session. The title, What Diabetes Educators Need to Know About Periodontal Diseases and Diabetes, is a little bit of a misnomer, only in that this information should not be limited to diabetes educators, but rather to all kinds of healthcare providers, to your friends, your family. Share this information because it largely is not known and not understood about by the majority of people, and especially those who have diabetes. So next slide. So why does this matter? And it matters because people with diabetes frequently have lower levels of health literacy and experience poor health outcomes. The other major reason it matters is because neither healthcare providers nor patients have adequate knowledge or understanding of the reciprocal nature of periodontal diseases and diabetes. Periodontal diseases simply means gum disease. Next slide. So it also matters because low knowledge or understanding has a major consequences for the patient's health, what providers and patients talk about or communicate with each other, and the types of education materials that providers might give to their patients. So this is critical for understanding of how to manage diabetes. Having the information and understanding the reciprocal nature of diabetes and periodontal diseases enables patients to take action to better control their blood sugar and prevent gum disease. Next slide. So it also matters because 34% of Marylanders have pre-diabetes, frequently and do not know it. 11% of Marylanders actually have diabetes, and 7% of Maryland women have gestational diabetes. These are women who experience gestational diabetes are more likely to be diagnosed with type 2 diabetes later on in life, compared with women who do not have this condition. Next slide. So the objectives for this webinar are that you will be able to describe what periodontal disease is and how it can impact diabetes outcomes. You will be able to list 3 important facts and behaviors patients should know about periodontal diseases and diabetes, and be able to describe what patients with diabetes should discuss with their providers about routine dental care. Next slide. Periodontal diseases actually are infections of the gum tissue surrounding teeth in the upper and lower jaws. That's a huge area if you think about it. If you look at how big this area is and hold this out, it's a huge section of your body. And any infection in the body makes it difficult to maintain glycemic control. Next slide. So gingivitis is the initial stage of periodontal disease. That means that gums are inflamed, puffy, and red. Bleeding is likely, but not always. It is reversible with thorough brushing and flossing on a routine and frequent basis. Next slide. So bleeding gums are clearly a sign of gingivitis, usually a sign of a lack of thorough and regular toothbrushing and flossing. Remember, this is something that all of us can get, but all of us can actually prevent and continue to prevent it. Next slide. Periodontitis is an advanced stage of periodontal disease. The gums are inflamed, puffy, red, bleed easily, sometimes just to the touch. Requires professional treatment, including likely surgery. Most adults, about 42%, over 30 have some form of periodontitis. Many of them do not know this. Next slide. The relationship to diabetes is that the majority of individuals with diabetes also have periodontal disease. If an individual has diabetes, they likely also have periodontal disease. If an individual has periodontal disease, they likely have or will have diabetes. So they likely have prediabetes. Next slide. So how diabetes educators can help. It's important that all of us, but especially diabetes educators, know and understand this reciprocal nature and educate your clients about the critical need for self-care and professional care, in that need for scrupulous oral hygiene. That means brushing with fluoride toothpaste 2 times a day, thoroughly, and flossing daily. In addition, they must see a dentist or dental hygienist on a regular basis. Not the usual every 6 months, but the more frequently, like 3 to 4 times a year. That depends on you and your dentist. Next slide. So how, in addition, diabetes educators can help is by demonstrating and reviewing how to brush thoroughly and how to floss. So we're going to share with you 3 short videos. 2 of them have sound, 1 of them does not, so don't be disturbed if you don't hear anything. But let's take a look at these and then we can discuss further if you're interested. Okay.
All right, we're switching over to the videos.
The modified fast technique of toothbrushing is used by patients that have good manual dexterity and limited gum recession. The brush is placed at a 45-degree angle onto the front surface of the teeth, with the bristles projecting into the pockets surrounding the tooth. A small circular motion is made with the bristles into the pocket. Then, the bristles are swept from the gum line to the biting surface of the tooth, brushing over the entire front surface. This technique is then completed on the inside surfaces of the teeth. The toothbrush is once again placed into the pocket at a 5-degree angle, completing small circles, then brushed from the gum line to the biting surface of the tooth.
So that was the first video. Alice, do you have any notes?
I do. I want to point out that this is one of several different methods The most important thing is that one should not use the scrub brush technique that we'd use on scrubbing the floor, and that you can also just use a little tiny wiggle back and forth, which will do the same thing to dislodge the plaque that the little tiny circles will do. Most important is to do so that you start in one location, work all the way around, and keep this as a constant so that you don't miss any areas. We should not be jumping from one side to the other and then missing, say, the tongue side. Okay, let's look at the flossing ones.
Any thoughts on that one, Alice, before we go?
Well, yes, well, this one for me didn't have any sound, but it should have had, and some pretty crazy music.
It was some music. I can play it again.
Okay, so the most important part here to think about is that you want to be very careful that you gently insert the floss between your teeth. Try not to snap the gum tissue because that can be traumatizing and actually cause bleeding if you do it too strong. The next one that you're going to see demonstrates very clearly the U shape that you should be running around each tooth. And it's doing a U in between the same two teeth and around each of those two teeth. Take a look at this.
All right, and there is no audio on this one, so don't be alarmed.
Right.
There's no sound.
Okay, thank you, Anna. And just to reiterate, remember we should be flossing first, all the surfaces, side surfaces, and then brushing, because the flossing will help not only dislodge plaque, but also food remnants and these kinds of things. So, and again, your dentist may teach you a different way, or your hygienist may teach you a different way, but the most important thing is to do it and to do it as recommended. Okay, next slide. So questions that patients should ask their dental provider include, how often should I have dental appointments? How do my gums look? What else can I do to have a healthy mouth? And should I see a periodontist? A periodontist is a dentist who has extra special training in treatment of periodontal diseases. And when and many regular dentists do not take care of patients with periodontal diseases. They send them to a specialist. So keep that in mind when you are referring any of your diabetes patients that they may run into this. Next slide. So how to help patients get care. So we do have a challenge here in Maryland because many who have diabetes are Medicaid or Medicare eligible, but Medicaid does not cover adult dental care in most states, and most patients don't qualify. Adult patients don't qualify here in Maryland. Maryland Medicaid pays for some dental care for pregnant women. Medicare does not cover dental care unless it is deemed medically necessary, and unfortunately, having diabetes is not at this time considered that. Therefore, we need to find available services from either federally qualified health centers who have sliding fee scales and other city or county clinics that have free or low cost services. At the very end, we will share a resource with you that you can look up for your clients to help find them dental care. Next slide, please. So we have created a checklist that you may want to use with your diabetic patients. And for example, we want to start by asking, when was your last dental appointment? If it's more than 6 months, they need to schedule an appointment. And of course, because that may be a challenge, we need to ask, do you need help finding a dentist? And if the answer is yes, which most likely going to be, then we will use a resource that is from the Office of Oral Health and help them locate a dentist. Third point is to ask, do you have bleeding gums? If the answer is yes, we remind them they need to brush 2 times a day with fluoride toothpaste and floss daily and get to a dentist. Then we need to demonstrate how to brush and floss and ask the client to show you how they are brushing and flossing. And then you can then provide assistance if necessary. Next slide. And finally, it's very important to help your clients that if you would set and monitor oral hygiene goals. For example, if you have a client who honestly responds and says, when you ask them when they brushed last, and they said, 3 days ago or last week, then you need to help them set a goal that they would try to brush at least once a day until you work up to the twice a day. Same with flossing skills. And again, you would want to make sure that they know how to use a given technique for both brushing and flossing. Finally, we would want to ask, are they seeking and keeping dental appointments at appropriate intervals? A lot of times, individuals have trouble with transportation. They may have trouble with babysitting, grandchildren sitting, to keeping their appointments. So all of these things are important, and this is an important checklist for you to use with these clients. Next slide, please. So in summary, people with diabetes are also likely to have periodontal disease. And periodontal disease makes it difficult to control blood sugars. This is key. Make sure that all of our clients know this. People with diabetes can prevent this problem by getting dental care routinely and brushing their teeth twice a day with a fluoride toothpaste and flossing once a day. Next slide. You can help by providing oral health education and guidance to program participants and to your family, to your friends. This is very, very important information, actually, for all of us, because we all may be at risk for periodontal disease and diabetes. Next slide. So these are resources that we suggest you take a look at. The fact sheet on diabetes and oral health is very well done, and you can get it by this link. Next slide. We're missing some of the resources. I'm not sure why that is.
So all of the resources here.
Well, the Maryland Oral, sorry, thanks, Anna. The Maryland Oral Health Resource Guide is the one, by the way, where you can look up and see where there might be dental care available for you. Next slide. So these are previous webinars and recordings that if you didn't get to see them or you would like to look at them again, they are available and you can get them on this website. Next slide. So what questions do you have? And remember to do the post-webinar evaluation and join our email list. And you're welcome to this slide deck and you can contact us. This link. Are there any questions?
There are currently no questions, but if you had to say the main takeaway from this, what you want diabetes educators to know, what would you say the one main takeaway would be?
The one takeaway is that they can really make a difference in their patients' lives by teaching them about good oral hygiene and the necessity of it and the reciprocal nature of periodontal disease and diabetes. They really are a key link to this patient being able to control their blood sugar.
Okay. Folks who are tuning in right now, you're welcome to put your questions in the Q&A box and in the chat, and we can relay them to Dr. Horowitz. Give folks a few minutes here.
Mm-hmm.
There's one question here. I've read that this information applies to both type 1 and type 2 diabetes, but I wondered if you can confirm that.
Mm-hmm. Yes, happy to. Indeed, it does. It is for both type 1 and type 2. Very, very important. Again, remember that the issue is infection. And I know that everybody on this list knows that if a person with diabetes has an infection, it's going to be difficult to control their blood sugars. So by preventing, or at least having periodontal disease treated so that it is then ultimately prevented, that this is going to help that individual maintain their A1Cs. Good question.
Do you have a sense of how many people with diabetes do not visit a dentist every year or as often as they should?
Well, unfortunately, there's a fair amount of evidence on that, only because, like with so many chronic diseases, and periodontal disease is a chronic disease, as is diabetes, that frequently it's at a higher rate among low income, and there are many problems with all of that, but it is a large proportion of the public that this is.
For those of us who are unfamiliar with the link between periodontic disease and diabetes, what other resources do you recommend to learn more? Any particular notable studies?
I could actually, if anybody wants to email me, I can send them studies and additional kinds of educational materials are available from the American Dental Association. They have pretty good leaflets on that for the general public. And CDC has some work in this area. NIH has a little, but not a whole lot, in the Heart, Blood, and Lung Institute. So I think those would be the main ones, yes.
Okay, you said American Dental Association, CDC.
Correct. CDC has some, and I mentioned the Office of Oral Health. They have the one leaflet that is largely based on CDC information.
That attendee said thank you.
Mm-hmm.
Last call for questions, anyone? Well, I think that's it. I don't see any others coming through. Okay, well, I think that those are all of the questions that we had, Alice.
Okay, sounds good. And you gave them my email, so I'd be happy to send them other things if they're interested.
Yes, I put in the chat, and I'll make sure it'll be on our page where folks can access previous recordings.
Right, good.
So,
and thank you all very much, and thank you, Anna, for your great assistance.
Yes, well, that wraps up our entire webinar series. I want to thank everyone who has joined in either once or all 6 times. Again, all of our recordings are up on this page on this link here, go.umd.edu, MDH training sign up. The one from today will be up by tomorrow. If you please could go ahead and finish our post-webinar survey, that would be great. And again, thank you so much for tuning in for this series of webinars.